HWO warns in a statement that thousands of lives are at risk here as medical oxygen supplies are starting to run out. What can you tell us?
That's right, Monte. Some hospitals have already run out and some are on the verge of medical shortage. And according to the WHO, the need for medical oxygen has increased by 20 to 25% since February 24th. Now, trucks are unable to transport oxygen supplies from the plants to the hospitals across the country and even in the capital. And this is why the WHO is looking to access oxygen from neighboring countries to then try to find ways to get it safely to the combat zones, to the hospitals as well. And this is why there's such an intense debate over these humanitarian corridors. Now, the problem doesn't end there because there's also a shortage of what we call zeolite, which is a chemical that's also used to make that medical oxygen. Now, surgeons typically use medical oxygen, of course, in combat zones to operate and to revive patients. But it's also used for other types of pathologies, such as complications related to pregnancies and also chronic disease. And of course, during wartime, all of these pathologies are left untreated. So when we talk about oxygen supplies, we also think about COVID-19, of course. And here we don't have a lot of data because there's no testing, so there's no reliable data. But it seems, according to people on the ground, that Omicron is the dominant variant. And it's also important to underline the fact that in the country, some people are saying that we could face a shortage of blood supplies as well as regular donors, because when you draw blood, you can only keep it for about 28 days. So it could become a problem, in the weeks to come.
Well, so it's not only this problem of delivering the medical supplies, but also getting it there in time to treat the people that need the help.
Absolutely. There's a huge humanitarian aid coming from all over countries throughout the world. And there's actually a 36-ton shipment about to come in with medical supplies for trauma care and surgery. And it's set to come into Poland this Thursday. And now the type of medical equipment that you're going to need in war zones is actually linked to the type of injuries, of course. And that's linked to the type of weapons that are used on the ground. And in Ukraine today, it's safe to say that doctors are essentially facing shrapnel injuries, of course, linked to bombardments, but also severe burns and a lot of pneumothorax. Why? Because it's triggered by the blasting effect that's caused by the different explosions. And these are all wounds that are resulting from, there's also, the wounds that are resulting from the infantry combat, so assault rifles, but also grenades.
Well, so, many of the wounded who die on the battlefield, it's not just the fact that they don't have the help they need. It's just that the medical supplies aren't getting there in time.
The medical supplies, but also the aid workers aren't getting there on time. That's what we call the golden hour, trying to get there in the hour after the injury. As you know, explosions can, of course, tear limbs apart and lead to heavy bleeding. And today we actually have new types of bandages, new tourniquet techniques that have been developed and tested on the ground, let it be in Afghanistan, but also in Sahel. And they were all developed in research and rescue operations, and they can really reduce the death rates significantly on the battlefield. Now, these techniques were actually used also in France in 2015 during the terrorist attacks, with a huge collaboration between civilian and military doctors. Now, passing on that knowledge is very important, and we actually see it also today because you have doctors in Quebec, for instance, who have created these sort of survival tutorials, not only for emergency workers on the ground, but also for Ukrainians, for them to be able to act swiftly on the ground.
Well, so if this conflict lags on, other problems could arise, like shortage of anti-cancer drugs and other health problems that are affected.
Right. There could be also shortages of different medical supplies, such as antibiotics. There's also already a problem with vaccines against childhood diseases, such as, for instance, polio and measles. And when people are displaced, of course, they are much more vulnerable to certain viruses and to certain epidemics. As Dr. Ibrahim Sokefal, he's the Assistant Director General for Emergency Response at the WHO, explains.
It's important to remind people that the WHO already worked with Ukraine to respond to epidemics, the COVID-19 pandemic, but also the polio epidemic. So the infrastructure was already set up to react to these emergencies, but also to deal with a number of refugees in a humanitarian context. So we're working to set up what we call an alerts and surveillance system for these emergency conditions. And we're also working with different hospitals we've located so that information about epidemics can trickle up.
So, Monte, I think you get a global view of what's happening right now. The situation is clearly critical on the ground, and there's an urgent need for these humanitarian corridors to be open.
Yeah, interesting to see also how it's affecting the overall health system in Ukraine.
Absolutely, and unfortunately, I think we don't have time to cover that. But it's true that in Ukraine, the medical system was actually they started a lot of different reforms in 2015. So it's a little bit more modern than what it used to be, but it's definitely not close to what we're seeing in other Western countries in Europe.
Okay, Julia Seeger, our health editor. Thanks so much.
Thank you, Monte.